So first of all, I would like to ask for your permission to use this video for educational purpose and on internet.
Yes.
Okay, now tell me, what were your symptoms before the surgery and how long did you have those symptoms?
My symptoms were pain in the lower back and one that extended down both the left leg and the right leg. And I had them for about 12 years or so.
How bad were they at the beginning? How bad were they just before the surgery?
It was when I would have a big flare up, it would basically I wouldn't be able to get up. I would barely be able to walk. It was pretty rough before the surgeries.
Surgery was in December, but before the surgery we as well did the discogram.
Yes.
But before even we talk about the discogram, how bad have you been treated before you and I met?
Well, I'd had just doing chiropractic work as well as pain medications and muscle relaxants, and then I also had facet joint injections done as well, and nothing seemed to really help or fix any of it.
Went on for 12 years?
For on and off for 12 years or so.
Okay, and then it finally came to a point that you just couldn't do more.
Yep. The pain just got so bad that I just needed to elevate it to some level because nothing else was working at that point.
Okay, and then we did the discogram. Tell me a little about your experience with the discogram. It wasn't fun.
Well, it is not a fun procedure, but it basically involved seeing if the discs and recreating the ultimate pain that comes with the flare-ups, and it did. I can tell you that. It
okay, and then based on that discogram, just 5 months ago, we did a 2-level minimal invasive fusion. And we did it in the 5, 4, 3. So 3, 4, 4, 5, 2 disc, and all of that is done minimal invasively. How long did you stay in the hospital?
I was in the hospital for about a day and a half.
Day and a half. So just one night.
Yep.
And then how long did it take you to go back to your basic daily activities?
It really only took, maybe a couple of weeks before I was, able to fully move around and, move around from room to room, be able to go out to the store and stuff like that.
We are 5 months after the surgery. How are you now?
100 times better. I mean, it's, my pain levels are almost non-existent at this point. I can move, I can go up and down stairs, I can bend over. It's just absolutely wonderful.
Excellent. I'm happy to hear that. Now, obviously, the bone hasn't healed yet. It still need about a year or somewhere between 9 months and 15 months, depending on the situation, to heal. And certain activity, I bet, still causing some aggravation. Tell me about those.
Yeah, some things when I have to bend over and picking up my kids or picking up something off the floor, I'll still get some pain, but it's it's much more easier to deal with that pain than it has been because the pain is a lot less and it's a lot more infrequent.
There is something we call BLT. It's not a sandwich. Do you know what that is? Bending, lifting, twisting.
No.
So that's not a good thing. You don't want to have that. That's we tell everybody, and these are especially the activity that make the symptom worse. And but overall, I think we are going the right direction.
Yes, I definitely agree. I'm feeling so much better than before the surgery.
Excellent. Now we put you through what we call Inspired Spine Protocol. After we maximized the conservative therapy, we did the discogram, and then step by step we put you through the steps, and we are still going through that protocol actually. So I will see you hopefully in about 6 months, and at that time we will confirm the bone is growing before we tell you go back and enjoy the life for the fullest. Okay?
Wonderful.
Thank you for the interview.
Thank you.
Okay.